We're back to the special simulcast of the Neil Haley Show and the Cutting Edge Benefits podcast with our host, Tom Quigley of Claim Links. And Tom, today our topic is I'm going to read from an article from HIP.org. Health plans are driving solutions to reduce chronic disease. Now, I'll read a couple paragraphs and get your comments because that's the thing. It's like the peanut gallery. Can't wait to see what you say. Reducing chronic disease starts with prevention. Fighting the chronic disease epidemic requires addressing the drivers of chronic disease. The most prevalent factors contributing to chronic disease include unhealthy eating, insufficient physical activity, low use of preventative screenings, medication non-adherence, behavioral health factors, tobacco, excessive alcohol use, and low health literacy, among others. To help these trends, AHIP convened a task force with chief medical officers and public policy leaders from more than 30 health plans, representing about 200 million covered Americans. First question to you. Did you know that they have a chief medical officer? Do you really trust that one for every one of those health plans?
I don't know. Do you trust the guy giving little bags of marijuana to your kids?
No.
There you go. There's your answer.
So basically, they were trying to come up with evidence-based strategies to reduce chronic disease prevalence by 10% by 2035. Okay, so let's see what they have. Voluntary health plan actions to advance prevention and better care. Health plans are voluntary, building strategies across 5 categories designed to improve: promoting healthy behaviors, early identification and care management, behavioral health prevention, screening and integration in care, preventing and managing diabetes, reducing cardiovascular disease, and expanding cancer screenings and early detection. Now, what are your thoughts? How would a health plan do that?
Well, they add in wellness programs, they add in things that cost you more money where you can do it cheaper yourself. So I agree with everything they were saying in terms of, what you need to do and not do, other than I think people should have a few drinks now and then, but that's my opinion. Um, Other than, smoking and all that other stuff is obviously not good. And, but is it going to reduce your health insurance premiums? No. Why? Because the insurance carriers, the smaller groups and the individual are all dictated by departments of insurance who charge premium tax. Well, do they want the premiums to go down? No. I mean, the whole system's corrupt. So the question is what do you, this is what you should do. You should get yourself a functional medicine kind of doctor who gets, they draw blood and they do things, they test you. I use direct primary care doctors on that way. And what they do is they get the labs needed to make determinations on how to change certain diets, how to change certain, what supplements you should be taking, not walking into GNC or any of these other vitamin shops, getting an actual diagnosis of what you need, what you lack. If you lack vitamin D, having the supplement there. There's all kinds. There's Genova Diagnosis, where they're up in North Carolina. They have you do urine and blood, and they create your own vitamin for you. It's pretty cool. I did that for about 3 years. But here's the gist: is people are not doing those kind of things. Insurance doesn't cover that.
So insurance needs to be able to cover these things to really,
yeah, but then your rates go up
chronic
because they're going to make a profit on everything they put out there. So you can go direct for a lot less money. See, the trouble is people, all they need from the insurance carrier is catastrophic coverage and a network. That's it. Everything else is a terrible buy. So why wouldn't you just go? The companies, if they care for their employees, should be setting up a medical expense reimbursement plan and covering these items I'm mentioning because they can do it all tax free. So for working for them, hey, we have these things we do for you. Boom, 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 boom. Give them direct primary care options, functional medicine options, wellness options, all these things. But if they think they're going to control their health costs, they're sadly mistaken, because it's all corrupt, and they're all about keeping the stocks high.
Exactly. So here's some more things, and now you're going to say this is a bunch of it's not happening. The task force also recommended targeted federal and state actions to strengthen prevention and care management, including modernizing regulatory policies to support healthy behaviors, enabling prevention, focused quality and value based payment models, expanding health plan benefit flexibility, leveraging and improving technology to enhance data, and also optimizing care delivery and strengthening the healthcare workforce. This is I would say, a pie in the sky dream for our
Do these
health
people
system.
get paid? Do these people get paid to come up with this shit?
Yeah, they got paid for it.
Jesus Christ.
They got
What
paid
a
for it for
what a
going
waste of
20
money.
for 10%. You got to
What?
go with the carrot stick mentality for healthcare. And that goes back to, I guess, why they punished people before the Obamacare for pre-existing conditions. But you got to start in schools. You got to start with healthy eating, healthy living a healthy lifestyle. And
I
explain.
agree with all that, but again, they're not good when they force insurance plans to cover this BS. They drive the cost up. They should they should allow people a strip down, no frills policy that doesn't have any of this garbage, maternity for guys, all this stuff. Drive the cost of insurance down, and then let the companies cover things, including medications, where they can get better deals on generics and brands, and including on wellness and all this stuff that these people somehow get paid for it. I need to figure out how to get that gig. I think I'm too outspoken to do that, though. I would be like, you guys are idiots, and I'd
They
probably
should
be
be looking
thrown
at
off.
people that are really the healthcare experts versus chief medical officers that probably don't even perform medicine anymore to come up with these
No, they make
expertise.
more money being administrators and getting grants and stuff and gouging the people, like we talked in our previous episode. But here's the issue. The issue is, I don't disagree with what they're saying in terms of America needs to get healthier. I totally agree with that. Those are great statements, but they're going about it the wrong way. You don't do it through insurance. You do it through allowing people to go direct to these vendors who do it right, and that's where they're missing it, because they're trying to force insurance companies to cover that, and the insurance companies are for profit. They got to make stockholders happy, so they're going to charge what costs you, $100 for my labs. They charge 2,000. Same lab corp, same vendor for the labs don't make any extra money. Same with the pharmacies. It's all the middlemen are making all kinds of money. In pharmacies, it's the preferred brand managers. And all I'm saying to you is, the middlemen are the problem with the health system,
So
from the hospitals
how can you
to
eliminate the
everything.
middlemen?
What was that?
How can you eliminate the middlemen? That's my final
By
question.
Congress getting wise and getting smart and making people work on fees, not in disclosure, not this hidden. I mean, it's a pyramid scheme. They got rid of it in all other aspects, but insurance has the antitrust. So that's what they need to do, but they're not doing it, um, because they're all being paid off themselves by these lobbyists. So I mean, the whole system is flawed. The whole system could be cured overnight, but no one wants a cure, because a
Got it.
cure means less money.
Exactly. Wow. All right. So great information. We'll do some more of these articles because I think it's intriguing to get Tom's breakdown on this. But ultimately, at the end of the day, if you're allowing the insurance companies to can't control, they're just going to bill more and they're going to charge more. And
Well,
until
they're gone. They're trying to figure out how they can charge the most money and get people to buy it. That's it. The hospitals are increasing their load because they know the insurance companies are dumb enough to pay them. Um, Yet the government negotiates the best with hospitals, doctors. It's called Medicare. And that's why Medicare rates are down compared to under 65, even though they use it more. Think about that.
Yeah, it's crazy.
Why do you pay less? Well, the government subsidized some of it, created these deals, so they basically carved the middleman out.
Mhm. I think that if you look at things, if you make insurance go across state lines, like any other type of insurance, it would be so expensive, but they'll
Now
never do it.
it's the laws that the requirements they make the insurance companies have to put in their plans is why pregnancy is on all plans. That makes zero sense. You should be allowed to carve pregnancy out. You know, girls who have their tubes tied or guys can't get pregnant, even though I know there's a lot of people out there who would say differently in today's world. Um, Most of them are in Minnesota. So the point is, what is driving the costs up is all these things that you have to have in the plans, and they should carve those out. Let the insurance carriers, I'm not saying bring back pre-existing. I'm saying let them carve these items out that's driving the cost down, and those people who need it, let them pay for it. And the companies should self-fund that piece because the middlemen, they can carve out maternity and get better deals. The hospitals should, for people who should have much better um, rates. There's no control. They just do whatever, and you hear about price transparency and all these other buzzwords. Well, capital B, capital S, fill in the blanks.
Okay. All right. Go to claimlinks.com, schedule a call, Tom, today. Appreciate it, Tom. Talk soon.
Go ahead.
That was a special simulcast of the Neil Haley Show on the Cutting Edge Benefits Podcast, guys.